Welcome to Dr. Gore's show. Today's topic is 21st century laser for hair removal, wrinkles, spider veins, and pigmentation. It's a big heading, and laser hair removal, especially in South Asian skin, is very important topic. So I'm going to first start talking about what's a laser, what are the different kinds, what are the skin types, and we'll talk about individual treatment. What's a laser? Laser is a wavelength. It comes in a different frequency, and depending upon the frequency, the depth, where it attacks, how it works is calculated. Laser has been used in medical field for a long time. It has been used inside the belly for endometriosis, for adhesions, for precise point. It works like a knife, and that's why for very delicate incisions, cutting, laser has been used. Also, laser has been used for its other benefit because it destroys the hair follicle, it stimulates the collagen, it shrinks by heat the veins, as well as it reduces the pigmentation by destroying the melatonin. 21st century laser. What does that mean? Laser has been used for a long time. The traditional laser are a simple wavelength. They come for a few seconds, then they are off, and then they again come for a few seconds. It's very difficult to manipulate with those old lasers the spot size, precise size of the laser beam, the frequency and the duration that laser goes. It's very difficult, it's very cumbersome to use those machines. Also, because the laser produces heat, it gives little pain, like a sharp electric shock like pain, and it's uncomfortable for the person, especially when we are using it on a skin level. The 21st century laser, the XLHR, it uses a cooling technology. As you can see on the screen, this laser beam cools down the skin first and then it fires the shot. This is the way that the pain is very minimum. XLHR uses true wavelength. That means, as you see it on the screen, the length of the wavelength when the frequency is being delivered to the skin is for a longer duration. That means it's faster and it works better compared to traditional wavelength, as you can see below. Why is it important? Why this spot size, the wavelength, the frequencies matter? Because to avoid some of the side effects, we have to change the frequency. Depending upon the skin type, we have to change the kind of laser we use. There are a lot of pictures I can show of bad job done. Somebody got greedy, used the wrong laser for wrong skin type, wrong laser for wrong treatment. There are few pictures on the screen where there has been complication when laser hair removal has been done in the hands of wrong person. So let's start with skin type. Fitzgerald-Patrick divided skin types into type 1 to type 6. Type 1 is very blonde haired person with very pale skin, with freckles, they burn easily in the sun. That's type 1 skin. And type 6 skin is mostly very dark skin, doesn't get sunburns. Most South Asians, even though we might go in color from very light to dark people, we usually fall between 4, 5, and 6. Sometimes a lighter skin South Asian will go to an unexperienced clinician and will realize they use the laser which was not meant for their skin type. They use a laser which is for skin type 3, 2, or 1, and then they get complications. So it's very important to go and know which physicians you're going to, or which medical spa you are going to, and make sure they have a good knowledge of your skin type, especially with the South Asian skin, because we can have really bad complications, scarring, hyperpigmentation, and then those are very difficult to be treated. So once you know your skin type, the physician or the medical aestheticians will decide which laser is right for you, depending upon what treatment you need. Now, lasers for aesthetics has been used for years. What is the difference with the XLHR? The XLHR, as I said, uses the true wave technology. It cools it down. So as you see on the video, first a gel is applied on the area which needs to be treated. The patient eyes are covered because laser can go in the eyes. It can affect your retina because it can go and penetrate those areas. That's why eye protection is very important. Somebody who has an active skin disease where the area needs to be treated is a contraindication. Somebody who is pregnant is contraindicated to get a laser treatment. Somebody with undiagnosed malignancy in that area, it's contraindication. So make sure the skin which needs to be treated is clean, there is no active infection, there is nothing where there is a malignant growth, as well as there is no pigmentation which is there. So any permanent makeup, any skin moisturizer, etc. should be removed. Eye protection has to be worn by the patient as well as the provider and all the personnel in that room. So that's about the safety. Now, why do laser? It's not just that it's fancy or it's available now, but if you look, laser is not only green, because anytime somebody is using shaving cream, shaving, especially legs and hands, they use anywhere from 7,800 gallons of water in a year, while laser uses nothing. So it's green. Does it help financially? Absolutely. Average cost in a lifetime of a person is around 10,000 or more in shaving cream and shaving supplies or wax or creams, while XLHR is only 2,000 in a lifetime for the hair removal. Amount of time you spend is around 130 hours. In a person's time, you see 130 hours is a long time. While laser, you use few hours every 6 to 8 weeks. So it's really, really not only financially beneficial, it's green, it helps the environment, saves the water, money and time. That's why that initial investment, yes, it might look like a big number, but if you add everything up, it's definitely beneficial. Apart from that, just getting ready in time, you don't have to think about, can I wear a dress today, or can I wear a sleeveless thing today, or am I ready to go for an event? Look at that convenience. So yes, there is initial time investment, there is a money investment initially, but it's a long term benefits. So going to hair removal and lasers. Lasers have been used for hair removal for, as I said, for years. XLHR uses the true wavelength technology. Also, how it delivers, how it cools, helps to remove hair easily. Also, the ability to change from one frequency to the other, the ease of changing the spot size, the frequency, the duration of the wavelength or the pulse, it's so easy. One can go from really thick coarse hair in the private areas, underarm, to men's back, to men's belly. To find hair on the face is very easy to do. That is the advantage. Also, because of the ergonomics, it can be used very easily on curvy area, on uneven area, especially armpits, sides. Those are sometimes difficult to treat because of the shapes. With XLHR, it's easy to use in different curvature, different hair type, different thicknesses. Then why for South Asian skin? Because XLHR is the one of a kind of laser treatment that can be used for most skin type, because it has the two frequency that we can interchange. Hence, it's safe to use it in type 1 skin type to type 6 skin types. Hence, the side effect is the minimum. If one has to get this investment, one wants to get this treatment, would you like to go to somebody who's just going to waste your money? There's a high risk of complication. Or you would go to somebody who has the training, who knows your skin type, who's experienced. And that's why it's important to spend your money the first time with the right person. We get people who have been treated in some spas or in some salons where the experience hasn't been good. Then to treat these people is very difficult. To take care of their side effects and then retreat them can get challenging. So save your money and go to the right person. 21st century laser hair removal. Why? We have to do few treatment. Why one treatment is not effective? Reason being, as you see it on the screen, the hair follicle has few phases of development. It has an early anagen phase where it's starting to grow, anagen where it's growing, catagen when the root starts dying, and telogen when the whole hair follicle has died. By doing treatment every 6 to 8 weeks, we are targeting different cycles of the hair, and we want to destroy the root completely, and hence one needs anywhere from 4 to 8 cycles to destroy the hair follicle during that growth time, during those cycles, and hence one needs few treatments to be done. Firstly, when you go for laser hair removal, your medical doctor is going to take some pictures, is going to ask you a few questions about your sunburns, your history of anything, and then we take some before and after pictures. Sometimes we use a test area to make sure that you're not having any side effects or any issues with that, how your pain tolerance is, how comfortable you are. After that, depending upon the area we want, we usually ask patients to shave that area and not pluck, not wax, because we don't want by plucking or waxing the root to be removed. We have to destroy the hair from the root. If you pluck in or waxing before the treatment, it's not going to help, because then we can't attack the root. So when you come in, sometimes we do shave and then we do the pulse treatment. You come back in 6 to 8 weeks and we again treat the area. This way, few cycles are done and hair in the different cycles of its growth is destroyed. By 2 or 3 cycles, you'll see reduction in the thickness, the coarseness, and the amount of hair in the area which is getting treated. But for complete benefit, I think minimum 6 to 8 treatment cycle might be needed. Hair is something that, in my view, as evolution happened, right? We lost feathers, we lost a lot of thick hair and furry, like our ancestor gorillas and monkeys. So it has become much finer. Its use in those days used to be to protect us from the cold, from the changes in the weather, from the dust. It used to hold that. As we have evolved into human beings, we don't need much hair. It can be unsightly, but also it causes some discomfort and infections by holding sweat, by holding discharge. Some people get ingrown hair and abscesses that can be really, really sometimes difficult to treat. I have few patients who are darker skinned people, and they tend to get really, really bad ingrown hair and abscesses and scarring. And so this is not just for looking good or just for cosmetic. Sometimes the hair can be a burden and can cause issues, and that is why sometimes it's really a blessing to get the laser hair removal for those people. We're going to take a short break, and when we come back, I'm going to talk about XLHR use in spider veins, pigmentation, and wrinkles. This is Dr. Gaur's show on 21st Century Laser in South Asian skin for hair removal, pigmentation, spider veins, and wrinkles. We'll be right back. Welcome back to Dr. Gaur's show. So far we've been talking about laser technology, why XLHR is better than other laser technology, about hair removal, about different skin types and contraindications, safety measures, and why go to a physician. Talking about laser now for spider veins. Spider veins are not only ugly looking dilated veins on legs, but sometimes it can cause pain, irritation, and swelling, pigmentation, because those veins, when they are dilated, not only they look ugly, but they can leak and causes some amount of edema and water in that area. Laser treatment has been miraculous for those spider veins. Reason being, there is no cut needed. Unlike other invasive treatment, there is no injections. The results are pretty good with only one treatment needed, because the veins, as we treat, we can see the blanching directly, and that's all one needs. So this has been a great tool. Also, because of its cooling technology, there's not much pain, it's quick, and also it can be used for different curvature. You know, our calves, our ankles, there are bones, there is a different shape, and the ergonomics of XLHR really helps to treat those ugly spider veins. As you can see it on the screen, how the procedure is being done, and there is a blanching of the skin as the treatment is getting done. Again, XLHR, because of its special wavelength and true wavelength technology, it's good for South Asian skin. There's no much effect going around the area that being treated, least amount of side effects. So go and see your physician first, who does aesthetics, to see, along with your spider veins, can we treat your varicose veins. Depending upon the size, the shape, and where it is, some varicose veins also can be treated. So go and see the physician and get those ugly looking and painful spider veins treated. Now, laser for hyperpigmentation. Some of the people are born with some pigmentation, rashes, birthmarks. Sometimes it can be at a place that is not something one is proud of. Sometimes they put a lot of makeup to hide those nevi, pigmentation, discolorations. Laser, because it attacks the color, the melatonin, helps to reduce that hyperpigmentation to the pigmentation scar. As you can see here, the laser is being targeted on the area where there is a birthmark. And as you can see, as it gets treated, it gets lighter and lighter. One might need 4 to 6 sittings to get it to the normal skin tone. But there is no cut here, there is not much pain, and it's really safe treatment. Going to XLHR for the wrinkles. You know, long time back, we used to have patients who used to put really abrasive chemicals on their faces. They used to come back looking as if their skin was burnt. They used to undergo peeling. They could not go out of the house. They had to really wear good sun protection, otherwise they would damage their skin. People used to go underground for 4 to 6 weeks after getting those treatments. In today's day and age, how can we not go out for a few weeks? Hence, XLHR is an amazing tool to treat those wrinkles for facelift, very gentle, and the results are very natural looking, unlike when there is a skin tightening done or facelift done surgically. As you can see, XLHR works in the skin, in the subdermal level, stimulating the collagen. It fills up the collagen, it makes the wrinkles less visible and the face looking younger, energetic and supple without any injections or any harm, any surgery. You know, people have done anywhere going from Botox to fillers to injecting plasma to doing a facelift. There are a lot of different technology available, and sometimes it's very confusing which one is right for one. My motto in life is do what's least invasive with least amount of chemicals. Do not put anything which is foreign to your body. That's why the laser for wrinkle, I think, is the safest, without any cut, anesthesia, downtime, and no foreign body. It's just stimulating your own collagen, making it supple. It lifts the face up, reduces the fine lines and wrinkles, especially those around the mouth, around the eye areas, around the chin, making one look more youthful. We don't want to look from 60 looking like 30, but we want to look youthful. We want to put our best foot forward, and that's what this is all about. I've talked a lot about laser in 21st century for South Asian skin, but remember, you want to go to the right person for the right treatment, for the right laser, and the safety of laser. Otherwise, the results can be not very pleasing. And I'm very pleased to announce that we have an office in Manhattan now. As you can see it on the screen, that's our address, that's our website, and we do a lot of aesthetics there, starting from cool sculpt to sculpture to laser hair removal. So please call, visit us, and we are right here. This is Dr. Gaur Show. Please tell your friends and family to watch it on YouTube, www.youtube.com. Search for Dr. Gaur Show, and this show will be uploaded after it's aired.
You know, I tell people it's like mowing the grass. You want to overlap the rows into, as long as you see that spark and you can smell it.
Till next time, goodbye.